Hi, Jamie Little here. I'm going to do my assessment on head, eyes, ears, nose, throat, skin, neurological, and musculoskeletal function. This is my husband Matt, and he's going to be my patient today, and I'll scan the room so you can take a peek. Yes, I still have my Christmas tree up. And nothing up high. And nothing down low. Knock, knock.
Come in.
Hi, Mr. Little. My name is Jamie, and I'm going to be your student nurse today. I'm just going to provide for privacy, wash my hands. Can I take a look at your wristband, please? And tell me your name and date of birth.
Matt Little, 6/17 of 84.
Thank you. How are you feeling today?
Good.
And any pain at all?
Nope.
Excellent. What brings you in to see us?
Physical?
Okay, great. Or is there anything going on that you're concerned about before we begin?
Nope.
Excellent. Upon initial inspection of the patient, he appears to be dressed appropriately for the weather. I don't see any involuntary facial movements or body movements. Posture is erect and steady, and facial expression is appropriate for mood and affect. All right. So what we're going to do today then is we're going to start from the top and work our way down. And we will first start out with a set of questions about every individual part, and then I will go ahead and I'll go in and I'll do an actual touch and feel exam. You shouldn't feel any pain in anything that I do, so if anything bothers you, be sure to let me know right away. If you're uncomfortable with me touching any part of your body, let me know right away. Okay? All right, so can you tell me who the president is?
President Trump.
Yes, and can you tell me what day of the week it is?
Sunday.
Yeah, and what is the next holiday?
St. Patty's Day.
Yes, it is. Do you celebrate St. Patrick's Day?
Sure do.
You do? What did you do last year?
Went to dinner.
With who?
A friend.
Oh, good, good. Was it a friend from high school?
Mm-hmm.
Okay. Patient is A&O times 3. Thought process appears to be logical and is able to keep a normal conversation. All right, so I'm looking at the patient's head, and I see it as normal cephalic. I don't see any visible bumps, lesions, masses. Partial balding. Mr. Little, how long has it been since you lost the hair on the top of your head?
6 years.
Okay. Have you noticed any additional hair loss anywhere, or was that where it kind of stopped?
That was it.
Okay. All right. The hair that he does have appears to be evenly distributed, well maintained. It is healthy. Facial hair is healthy, evenly distributed. Okay, I'm going to go ahead and take a feel, okay? Let me know if you feel any pain. Anything anywhere?
Nope.
No? Okay. Do you ever get any headaches, Mr. Little?
Nope.
Do you ever get dizzy spells or anything like that?
Nope.
Have you had any head surgery? I didn't see any scars. No. Okay. Any trauma to your head? Any concussions anytime?
Nope.
Okay. I see that his face on inspection has good pink undertones, no lesions, no masses, no sores. Skin is dry and warm. Eyebrows are evenly distributed, they are symmetrical and set appropriately for his face size. Eyes appear, again, symmetrical and evenly set into the face. The sclera is white, the cornea is clear with no opacities, and the pupils are round and equal with a diameter of, I'm going to say that's a 5. Diameter of 5 millimeters. Mr. Little, have you ever experienced any issues with your vision?
Nope.
Okay, no blurriness, no spots?
Nope.
Okay, do you wear glasses normally?
No.
All right, do you see your eye doctor regularly?
No.
Okay, what you want to do is schedule an appointment with your eye doctor at least once a year. They're going to screen for things like glaucoma. They're going to screen for blind spots. They're going to check your peripheral vision to make sure it's safe for you to be out there on the road driving. Okay. Have you ever experienced any dry eye?
Nope.
Nothing. Do you get pink eye?
Nope.
No. Excellent. Okay. All right. So I'm going to go ahead and just take a peek in. Like I said, if any of this bothers you, let me know. Conjunctiva is pink and moist. Good. I don't see any drainage of the lacrimal ducts. There's no crust around the eyelash rim. All right, so what I would like you to do now is look straight ahead for me. I'm going to bring this light in, and then we'll go from there. Good. Pupils react both directly and consensually. And what I'd like you to do now, Mr. Little, is just look off to that side of the room. And on the count of 3, I want you to bring your focus back to my pen here. 1, 2, 3. Good. Pupils are accommodative, and now follow my pen. And they converge appropriately. Excellent. Now I need you to follow my pen with just your eyes, so keep your head straight. Excellent. No bouncing, no lag in the following with the pupils, so cranial nerve 3, 4, and 6 are intact. All right. Now, Mr. Little, would you do me a favor and turn your head to the left and to the right? And can you look up and down? Excellent. Can you take your right cheek to your right shoulder? Left cheek to your left shoulder? Very good. Is there any pain there? Any of that?
Nope.
Okay. No limited range of motion in his neck, no indication of any stiffness or pain. All right. So I should have mentioned earlier on the eyes, I noted it in my head, but I didn't say it. There was no ptosis or edema of his eyelids. It was very good distance. Ears are level with the outer canthus of his eyes. And I do not see any masses, lesions, bumps, swelling, or thickening of the skin around the ears. Skin color is consistent with the rest of the face. Mr. Little, have you experienced any issues with hearing?
No.
No loss of anything? Have you noticed that sounds are getting duller at all?
Nope.
Okay. Do you experience ear infections?
Nope.
Okay. How about drainage? Do you get anything?
No.
Just normal earwax?
Mm-hmm.
Okay. How do you care for your ears?
I just take a shower and clean them with Q-tips.
Okay, so Q-tips are great, except if you're not careful, you can get those a little bit too far in, and sometimes you can actually push the earwax into your ear deeper than it was. So it's really good practice to rinse with peroxide and water. Sometimes that is better for your ear, but I'm happy to hear that you're doing something. That's great. Very good. All right, so I am going to take a look inside your ears now, and we'll make sure there's nothing in there that concerns me, okay? I don't see anything in the outer canal of the ear, and I'll just touch real quick, make sure you don't have any pain on the pinna. Any pain there?
Nope.
On the tragus there? Mastoid process?
Nope.
Okay. Pull up and back on the pinna. There are no foreign objects, no drainage, no swelling, no redness. Very good. I cannot see the tympanic membrane in Mr. Little's ear without an otoscope. If I had one though, I would be looking for a pearly gray with a slight pull-up in the center, and it would be reflective of light. Anything?
Nope.
On the tragus?
Nope.
Mastoid process?
Nope.
Very good. Good. Again, no swelling, no foreign objects, no drainage, no redness. And he said that that didn't hurt, so we're good there. Mr. Little, right now, usually what I would do if I had one available is I would test your vision with a Snellen chart, would test cranial nerve number 2. I don't have one available with me, but that's what you're going to go to that eye doctor for, and they'll make sure everything is working good there.
Okay.
Okay, very good. Now, I'm going to have you smell something for me, and I just want you to tell me what it is you smell, but you need to close your eyes. Go ahead and inhale.
That's coffee.
Yes, very good. Do you drink coffee?
No.
Okay. All right, so how has your smelling been? It appears you smelled that just fine.
Good.
Good. Have you had any sinus infections?
Nope.
Any nasal drip, drainage?
No.
How often do you get colds?
Not really ever.
Okay. Do you have any pain anywhere in your nose?
No.
Have you ever had any trauma or surgery?
No.
Excellent. Okay, I'm going to take a feel and let me know if you feel any pain. Anything anywhere?
Nope.
Excellent. I'm going to just check your frontal sinuses. Maxillary. Any pain?
Nope.
Excellent. Okay. So cranial nerve 1 was intact by him successfully smelling the coffee. Mr. Lowe, can you tip your head back for me, and I'm going to take a peek inside your nostrils. No foreign objects. Moist and clear. No drainage. Turbinates are visible. I'm going to check for a perforation in his septum now. It is not deviated, so tip your head back one more time for me. Good. Good. No perforation of the septum. Excellent. All right, so what I want you to do now for me is we're going to make some funny faces. Can you raise your eyebrows? Excellent. Can you scowl? Yeah, very good. And now puff out your cheeks. And a big smile so I can see your teeth. Excellent. Cranial nerve 7 is intact, successfully made every facial expression symmetrically and equally. All right. Now we're going to do another little exercise with your eyes closed. So if you can close your eyes for me. I'm going to touch something on both of your cheeks. And what I want you to tell me is if it is sharp or soft. Okay? Are you ready?
Mm-hmm.
Okay.
That's sharp.
Very good.
That's sharp.
Very good.
Soft. Soft.
Excellent. Cranial nerve 7 is intact with appropriate sensation in the face. Very, very good. All right, so would you please open your mouth wide and close and open again and close. Now if you'll shift your bottom jaw from left to right. Did any of that hurt?
Nope.
Okay. Do you ever have any issues with your jaw?
No.
Very good. No cracking or popping or shifting in the TMJ, and the patient indicated that there was no pain there. Excellent. I'm just going to assess the beard really quickly and make sure that there are no lesions inside that I didn't see earlier. I can't. You've got a nice thick beard. Very good. Very, very good. No lesions, no bumps, nothing underneath the facial hair there. Okay. Upon inspection of the exterior of his mouth, I see that Mr. Little's lips are pink, they're moist, there's no cracking, no sores, no lesions. How has your mouth been? Have you experienced any sores?
No.
No? All right, moving in the inside, do your gums ever bleed?
No.
Okay. Do you ever get canker sores or anything like that?
No.
Any difficulty chewing?
No.
Dry mouth? Nothing. Okay, excellent. How do you care for your mouth?
Brush twice a day.
Do you floss?
Yep.
Excellent.
And use mouthwash.
Yay, very good. That's great. All right, when was the last time you went to your dentist?
A week ago.
And everything checked out fine?
Mm-hmm.
Fabulous. Okay, so what I'm going to have you do is just open your mouth, and I'm going to take a peek inside. Buccal mucosa is pink and moist. No bumps, no lesions, no sores. Patient has all 32 teeth. Teeth are clean, free of debris, no decay. Have you had any dental procedures ever, Mr. Little?
Nope.
Okay, wonderful. All right, so could you lift the tongue to the tip of the mouth for me? Like that. Very good. And up to the top of the mouth. There you go. Very good. Good. Ventral side of the tongue is vascular and the frenulum is centered beneath the tongue. The soft palate was pink and upwardly movable. His hard palate was a whitish pink and hard with visible normal rugae. Now, Mr. Little, back in the back of your throat, have you experienced any drainage or soreness?
Nope.
Nothing. Any sore throats? Did you get a lot of sore throats?
Mm-hmm.
Okay. Do you have any difficulty swallowing?
No.
Okay. Visible inspection, the outside of Mr. Little's neck. Trachea appears midline. He's got some facial hair growing, but aside from that, skin appears to be consistent with the rest of his body. No lesions, no bumps, no swelling. Do you ever experience where you can feel anything on your neck? Anything at all?
No.
Okay. All right. So I'm going to palpate for Mr. Little's lymph nodes, and then we're going to do the inspection on the inside of his throat. Okay?
Okay.
Let me know if this bothers you at all. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, okay, can you tip your head to the side for me? Deep cervical, and to the other side. Okay, and can you raise your shoulders for me? Excellent, keep them raised. Supraclavicular. Okay, go ahead and put your shoulders down. Okay, so the two things there were no palpable nodes. Was there any tenderness anywhere?
No.
No tenderness indicated by the patient. And when I asked him to raise his shoulders to inspect his supraclavicular nodes, I did give a little bit of resistance, and he was able to lift equally with both sides. So cranial nerve 11 is intact there. All right. Now we're going to go ahead and take a peek down into the back of your throat, and we'll just go from there. Go ahead and open your mouth and say, ah, good. Drop the back of your tongue. Excellent. Uvula lifts symmetrically. Tongue comes out midline, indicating that cranial nerve 10 is intact. The tonsils were visible, a 1+. There was no cobblestoning or exudate, and I didn't see any apparent postnasal drip, no drainage indication on the back of the throat. It was a nice pinkish red color, no inflammation or irritation. Mr. Little, can you say light, tight, dynamite?
Light, tight, dynamite.
Excellent. Cranial nerve 12 is intact. I did note after Mr. Little pulled his tongue back into his mouth, he did an immediate swallow, which would indicate that cranial nerve 10 is intact. Okay. All right. Any questions so far?
Nope.
Excellent. We are going to do a few exercises regarding your musculoskeletal system. And so just follow my instructions, and if none of them make sense to you, just let me know right away. Okay. Would you stand for me, please? All right. I'm going to just have you stand still for a moment and close your eyes for me. I'm going to make a noise outside of your ear, and can you tell me when you stop hearing it?
Mm-hmm. Right now.
Good. The other side.
Right now.
Good. And then can you please put your feet together and your hands down by your sides and keep your eyes closed. And I'm going to count down from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Excellent. You can stay standing. Cranial nerve 8 is intact. He was able to hear the slight sounds coming out from behind his ears, and he had very minimal movement and sway. All right, so what I'd like you to do now, Mr. Little, is start right there at the end of the table and just give me a normal walk to the other side of the room. Good, and come back. Excellent. Gait was steady and intentional. There was no involuntary movement, no stability issues. There was no hesitations in any of his steps, so it was very good. Can you come closer to me, okay, and just turn this way for me. I'm going to hold my 2 fingers up, and what I would like you to do is grasp my 2 fingers and squeeze. Very good. Strength is equal bilaterally. I'm going to push against you very lightly. Just give me some resistance. Good. And I'm going to pull. Give me a little resistance. Good. Strength is equal bilaterally. Very good. Now, I'll walk behind you here. And if you can just put your arms down by your sides. Very, very good. I'm going to keep my hands right back here throughout this. What I want you to do is raise your arms out to your sides. Good. And up above your head and touch your palms. Good. And drop those down behind your head. Excellent. And then down back behind your back. Very good. Was there any pain or anything in that exercise?
Nope.
Okay. I felt no crepitus in the joints, no shifting, no popping, and the joint is not red, swollen, inflamed, or anything like that, and patient indicated no pain in the movement. Okay. While you're here, go ahead and turn back this way for me. Excellent. I would like you to put your arms out, and then when you're ready, I want you to close your eyes and start slowly touching one fingertip to your nose, and then alternating. And as you go, speed up just slightly. Very good. Good. You can stop now. Good. Patient is accurately touching the fingertip to his nose, and there was no loss of function or loss of balance, so it appears that his cerebellar function is intact. Excellent. All right. Now, if you could go ahead and lay down for me on the bed. And put your feet right down here. Excellent. All right, so what I would like you to do first of all is I would like you to take the heel of this leg here and set it on this knee. Okay? And then I want you to run that foot right down to your ankle. Good, and the other side, just the same way. Very, very good. Any pain in your hip joints or knees when you do that?
Nope.
Very good. Now, keeping this leg straight, I would like you to lift this one up as high as you can. Very good. And the other side the same way. Excellent. Any pain in your low back or hip?
Nope.
Okay. Now, would you please press on my hands like gas pedals? Very good. And lift my hands up. Excellent. Patient has strength that is equal, bilateral, good range of motion in his hip extension there, and he did follow a straight path down his shin, indicating that he has good balance and cerebellar function. Okay, now Mr. Little, I'm going to run something along the bottom of your foot, okay?
Okay.
Good. Very, very good. Babinski reflex, as expected, his toes curled down. Very, very good. All right, Mr. Little, you can sit up now if you'd like. Do you need some help? Very good. Okay, I'm just going to do one quick look through, make sure that there wasn't anything that I missed on you. Yes. Temporal arteries are a solid 3+. I do want to take a look at your arms, if you can just set them out for me like that. I noticed earlier you had the tattoos, Mr. Little. Are any of these new?
No.
Okay. How did they heal when you got them?
Well.
Good. No issues with any of the tattoos that you've had?
Nope.
Very good. All right. I'm going to take just a touch on your arms here. I'm looking at his joints. I don't see any swelling, redness. I don't see that there's any indication of bruising. I'm just going to take a feel here. Can you bend your elbow and curl it back in? Very good. And on this side, same thing. No swelling, no redness, no apparent inflammation or trauma. And can you bend your elbow and back in? Very good. Good. I don't see any indication or feel any swelling. I don't feel any nodules on his knuckles. There was no cracking or popping in his elbow joints, and the joints and muscles are sized appropriately for the frame of his body. I think we've got everything that I need, Mr. Little. So what I'm going to do now is I'll go chart everything out in the hallway, and the doctor will be in to take a look at you, okay?
Okay.
Do you have any questions about anything we've gone through?
I do not.
Okay. So I'm going to wash my hands, and I will pull the curtain back so I can leave the room. Thank you very much, Mr. Little. Have an excellent day.
Thank you.